Botox, it's all the rage for the aging boomer and Gen X crowd, and Gen Y and Gen Z seem to be getting in early on so-called cosmetic injectables too. But is this booming industry being properly regulated? Government regulation is everywhere where we least want it, but when health authorities are actually needed, they seem to be nowhere in sight. For years, Australia's rules around prescription-only cosmetic medications like Botox and dermal fillers have been crystal clear. These drugs require strict compliance when it comes to prescribing them, storing them, and overall administration of clinics. Yet in practice, the rules have often been ignored or subverted. This is because of a perfect storm of factors that have hit at the same time as this nurse-led injectables industry boom. We've had telehealth technology, new commercial remote doctor models, and inconsistent enforcement, all creating what some describe as a massive loophole culture in this new industry. Across the country, many cosmetic clinics have simply failed to comply with established health regulations, something which experts say is putting patient safety at risk. Joining us to talk about it is one of the doctors in the industry who's a little concerned about the way things are being run and how lax some of our state health departments have been with their policing and enforcement. Dr. Dan Bezjak runs a clinic in Brisbane called ARDENT Aesthetics. Dr. Dan, thanks very much for your time and thanks for joining us on the other side. What is the issue with this at the moment? We've got clinics where I guess it's nurses that are mainly doing these injections, but aren't they always supervised by doctors?
So, Damien, firstly, thank you for having me on the show. As you said, there are supposed to be doctors in the clinics overseeing the nurses. There are fairly strict guidelines with regards to providing that supervision and as well as, handling of medications. But as you alluded to in your introduction, what we've seen is that remote doctor prescribing services have, absolutely boomed over the last few years. It's now a multi-million-dollar industry. And as a result, what we've seen is doctors that are working remotely, not at the practice,
right?
Rarely, if ever, there. And what we see then is that they're doing the prescribing for these nurses without supervision. And I've heard stories where doctors have been walking their dog in Melbourne, doing prescriptions, doctors on the beach at Noosa doing the same thing.
Right. Okay. Well, the patient might be in Sydney or Perth.
Yes, or in Brisbane. Yeah.
Brisbane.
Yeah. Quite remote.
Yeah. All right. So this is not good. I mean, that obviously is a bit of a sneaky way of getting around the rules to a certain extent, I guess. The other thing is the actual chemicals themselves, right? Because so when they're prescribed, they're actually there on premise. Is that right? So the nurses can access the.
So this is where the problem has exacerbated. So we've had doctors that should have been at the site who should be controlling the medication.
Yeah.
They'll purchase the medications. They'll be in control of the storage of those medications and then the administration through prescriptions. What we've seen is that often nurse-led clinics are getting around this by purchasing the medications directly themselves, storing it under their own name and controlling it, and then getting a prescription from the doctor to then administer that medication.
So is that legal?
So there are laws, federal and state laws that govern the use of these medications. In Queensland, we have they've been in place since 2019 or updated. South Australia's 1984, and for the federal laws, they've been around since 1989 under Therapeutic Goods Act. And so these laws specify how these drugs are supposed to be managed and that they're safe. That's what the TGA do. But at Queensland, and the other states, what those laws then describe or regulate is how these medications are then handled and then administered. Okay. So that's not legal in terms of complying with the law.
Industry norm. It's the norm in most practices.
So I wouldn't like to say it's normal in most practices. I think there's some nurse-led practices that are actually trying to comply. I think there are ones that are probably trying to run the gauntlet. And there are probably ones that are quite rogue and doing the wrong thing altogether by working out of a garage and ordering medications from overseas without TGA approval.
So what are I know that And I mean, probably this is why we don't hear of a million problems, but it's pretty rare that things go wrong. But when things go wrong, it can be pretty bad, right? I mean, what can happen?
Yeah. So cosmetic medicine is actually medicine. So in terms of any treatment, there is always a risk of an adverse event. And in cosmetic medicine, there are the normal risks of bruising, bleeding, infection. But with dermal fillers, which you would have heard about, hyaluronic acid, dermal fillers, they're usually injected under the skin.
Yep.
The problem is that they can cause a blockage of a blood vessel. And then what you have is death of the tissue that blood vessel was supplying nutrients to and oxygen to. So there is reportedly a 1 in 5,000 to 1 in 10,000 chance of that occurring. I believe that those figures are actually underreported and that we are probably seeing a far higher incidence of these occlusions, these blockages of these blood vessels.
And what can those blockages of blood vessels lead to?
So what we normally see is usually some damage to the tissue. You'll see maybe a little bit of scarring or an infection as a result. But at the worst, they can lead to significant scarring and, in rare cases, blindness.
Whoa, okay. Right, because it's in that area that's where those blood vessels reach the eye.
Yeah, it's a little bit unclear how it works because the blood vessel that supplies the eye actually comes from behind the eye, from the inside the brain. Mm. But there must be connections that we just don't know about where the external supply, the supply that provides oxygen and nutrients to the skin, has a connection or a network with the blood vessels that are internal. And so these have happened on a number of occasions overseas. And I understand that there was an incident here in Australia as well.
What could you talk about that, or what do we know about?
Look, I'd rather not talk about the Australian incident, right, but certainly the overseas incidents. What we've seen is where there's been blindness. In some cases, they've been able to salvage some vision.
Yeah.
In some cases, they've completely lost the eye itself because the eye dies. So,
the more common problem, though, I guess, is just the blockages and the scarring.
The more common problem is the blockages and the scarring. And as I said, I think that the incidents are actually underreported.
Right.
So, and what's happening is that the dermal filler is being often injected with a needle. And the problem is that the needle will penetrate a blood vessel without the nurse knowing. And as a result, the filler will then be injected into the blood vessel.
And what happens then?
And that's then what causes blockage of the blood vessel.
Oh, sorry.
The filler expands and then blocks off that blood vessel.
Wow. Okay. Yeah. All right. So you've got to be careful of that. Anything else? Any other sort of risks that people should be concerned about?
Well, that's the main risk.
Okay. So what do you need to ask if you're going to a clinic? What should people be saying to the nurse clinics and to the nurses running those clinics? What do I need to know? That's
a great question. The first thing I'd ask if I'm making an appointment with a clinic, I'd like to know if there is a doctor on site, not a doctor that is working in Melbourne where they're going to ring them up, particularly if there's an emergency. So if something goes wrong, you want the doctor there to help out. You don't want them, ringing them up on the phone, or in one case, which I heard of, which is sending the patient off to the emergency department at a hospital.
Yeah.
So
when there's a medical emergency, you don't yell, "Get me the nurse." You yell, "Get me the doctor." Right?
Well, I mean, you're normally asking for help, but yeah, having a doctor there so that they can manage the emergency. The second question I'd really like to know if I was booking an appointment is, does this clinic, particularly if I'm having a dermal filler, does this clinic have an ultrasound machine? So that is a machine that allows you to scan the blood vessels in the face. And I think it's akin to if you were to be driving at night and leaving your headlights off, so you can't see where you're going. With the ultrasound, you can see where the blood vessels are. You can then avoid them and not have these complications.
So you have a ultrasound scan before they do the injections.
Certainly at my clinic, we will scan before we do any hyaluronic acid dermal fillers. And
so you just need to ask the clinic if they've got
ask the clinic if they've got it.
Yep.
The other thing is, if we do have an emergency, and because I actually work at the clinic, if there is an occlusion or a blockage of the blood vessel, we can use the ultrasound to identify where that blockage is and then take measures to quickly remove that blockage.
Okay. Now, I was going to ask how this has gone unregulated for so long. I understand that some states are starting to get their act together in terms of policing and clamping down a little bit.
Yeah, so Queensland in December last year, by the Medicines Approvals and Regulation Unit, released a guidance to nurse-led clinics and to those remote doctor prescribing services.
Okay.
To provide essentially how they should be doing business with regards to the handling of medications. And they've given them, fair notice. The regulations were going to be enforced by Queensland Health as of the 1st of September. And we haven't, I don't know if anything has happened thus far.
All right. Well, Dan, thanks very much for explaining all of that to us,
Sure.
and give us some tips on the sorts of things that people should be asking if they're going into these clinics. You've got your clinic, of course, in West End in Brisbane.
Yes.
And there are numerous other clinics around the country, no doubt, that have doctors present that people can
Absolutely
touch into and tap into. So perhaps best, not that there's anything wrong with the nurse practitioners. A lot of them are exceptionally good.
Yes, absolutely.
But it is, it's probably wise and prudent to make sure that some of these guidelines are at least being followed. And it's good to hear that some of the state governments are actually getting into line and doing something about it now. Dr. Dan Bezjak from ARDENT joining us on the show there, and we'll be back in just a moment. A great way to support the other side is to support our sponsors like Smart Kits Australia, the best supplier of do-it-yourself prefab home renovation kits. And it's not just carports. Smart Kits do decks, patios and pergolas, flyover roofs and insulated roofing too. All prefabricated, fully engineered and delivered anywhere in Australia. And if you're not too handy, they'll install it for you too. Get onto it. smartkits.com.au. That was a segment clip from our weekly Friday night news show, The Other Side, which you can watch in full by simply going to YouTube and searching up The Other Side Australia. Then you'll find our full shows playlist. You can also find all of our full shows and our segments on our own website, othersidetv.com.au. That's othersidetv.com.au. Help us build a whole new Aussie media by joining us over there and signing up for the exclusive side.